Hello everyone, today's video is on leukoplakia. As the word suggests, leuko and plakia. Leuko means white and plakia means patch. Now I'll tell you some of the definitions. So these are the definitions. The one which defines it and the one which is given by the WHO. So as the first one, it tells that it is a white patch on the mucosa which cannot be scraped off or rubbed off and which cannot be attributed to any other diagnosable disease. So it defines leukoplakia, whereas what the WHO told is that it is a white patch or plaque, cannot be characterized clinically or pathologically as any other disease, and it is not associated with any sort of other disease as well as any sort of causative agent except tobacco, as I have told in this WHO definition. Then after that we have to classify it. There are various classifications, some of them I have told over here, like it can be homogeneous or non-homogeneous. On the basis of homogeneous, I have given this 4 things: flat, corrugated, pumice-like or wrinkled. Flat means it is just, as we can say, it is flat, no nodules or anything over it. It is just like a table surface. Corrugated. Next is the corrugated ones, which I can tell you corrugated as it appears like a beach of an ebbing tide, which it is popularly known as beach of ebbing tide. As what this means like if the water, when we are on a beach and the water comes and when it leaves, there are some of the corrugations present on that sand. So in that way, this is popularly known as beach on ebbing tide appearance, which is the corrugated one. The third is the pumice, which I can say pumice like is like fine line patterns, and wrinkle, as we all know, it appears like a wrinkled surface or dry crack mud surface. It is popularly known as dry cracked mud surface, wrinkled one. Now I come to the non-homogeneous. There is nodular, verrucous, ulcerative and erythroplakic. Nodular or speckled. Nodules means this, sometimes of small, round or speckled. These are the appearances or the projections on the surface. As this is not homogeneous, if it is homogeneous, this is 4 categories. Non-homogeneous means the surface is not flat. That is, it is why known as non-homogeneous. As well as non-homogeneous refers that it is not continuous. Okay. Then nodular or speckled, as I have told over here. Verrucous, I can tell you, like there is papilliform projections. As you know, there are many such projections. I can show you such a diagram of verrucous. There are many number of such projections over it, so it is known as verrucous. Next is the ulcerative. As we all know, ulcers, the eruptions like this, ulcers over it, so it is known as ulcerative one. And erythroleukoplakic refers that it is reddish, erythro, and leukoplakic means it is leukoplakia. So the next classification is based on the etiology. On the basis of etiology, it can be tobacco induced and non-tobacco induced. Means the causative agent can be tobacco or cannot be tobacco. I'll tell you other causative agents later. The next is upon the risk of development of oral cancer. There are 3 categories like high, low and intermediate. High risk sites or dangerous sites, I can say, is on the floor of mouth, on the lateral and ventral surface and on the soft palate. The high vascularized zone, I can say. Then comes the low risk site, comparatively less vascularized, but yes, it is also dangerous, but it is comparatively less dangerous as compared to the high risk zone. So it is on the dorsal surface and the hard palate. The rest is they have categorized intermediate in all these other sites which are not categorized in these categories. After that, they have classified it as, on the basis of histology, as dysplastic or non-dysplastic. The dysplastic, the word dysplasia tells there is alteration. So there are alteration present, non-alteration. So what sort of alteration? For example, I can tell you some. That the nuclear cytoplasmic ratio is altered. Rather than normal, they are increased. The size of nucleus as well as the site of nucleus are changed. Then many are there. The number of the cells are increased as compared to normal. So these are the dysplastic changes, and non-dysplastic means it is normal. Then according to extent means it is localized, that is on a particular surface, like on the buccal vestibule, on the hard palate, or on the soft palate, or diffuse, that is they are present on many sides. So can more than one, like I can say diffuse. Then according to Banos, he has categorized leukoplakia into 3 sides, like leukoplakia simplex, leukoplakia erosive, and leukoplakia verrucosa. In the simplex, he has actually categorized the simplex as the flat type of leukoplakia, which we have done earlier in homogeneous type. So he has categorized the simplex in the flat type. Erosive, he has compared the nodular ones over here, whereas verrucosa, he gave this different verrucosa, he categorizes differently because of the papillary projection. I can tell you more, like papillary projection, it is also quite famous as. So as I was saying, the verrucous one, it is also very famous as proliferative verrucous leukoplakia. This is the case of proliferative verrucous leukoplakia over here. You can see these projections, these triangular ones, they are triangular projections, and there are many. So this is the case of proliferative verrucous leukoplakia. Some more, like this is non-homogeneous leukoplakia. Here, why this is this is a nodular type also, the nodules present. This is a non-homogeneous. Why? Because there is leukoplakia over here, whereas erythroplakia over here. So it's a discontinuous type, so non-homogeneous. Yes, this is a good diagram. This is of homogeneous type of leukoplakia. On the left buccal mucosa, they have shown these are cracked mud appearance, which is present over here. It is homogeneous. It is something leathery, okay, as well as cracked mud appearance we can see over here. This is the histological part. Yes, in histology, I can tell you that there is drop like appearance, not well defined over here, but actually there's a drop type of appearance when we see it as a histological ones. Here there are some of the important dysplastic changes as I was talking about. Loss of polarity, presence of more than one cell, increased nucleocytoplasmic ratio, drop-shaped ratty ridges, then irregular epithelial stratification. All of them are listed over here.